Hello, everyone. Welcome to our Migraine Strategy Call. I am Debbie Waidl, your migraine health coach specialist, here with a extremely special Migraine Strategy Call tonight. I have with me some amazing Freedom from Migraine Method alumni, people that have been where you're at, have gone through the program, and have found their version of migraine freedom. And what makes this panel call even more special is these are women that are knee deep in the healthcare system. So they wanted to come on tonight and share their experience and their journey and what it is like to be a part of the healthcare system and still not get the answers you're looking for, but then join us in Freedom from Migraine Method and actually start finding some relief. So I want to start this call off while I'm just double checking and making sure we are live in the right group. I am going to have each woman just give you a quick hello, introduce themselves, and let you know what they do. So Jackie, can I start with you and then we just kind of go around if that's okay?
Absolutely. I'm Jackie Phillips, and I am a retired nurse practitioner.
I'm Nicole McKenna, and I'm a registered nurse.
I'm Christine Becker. I'm a dental hygienist.
I'm Susan Walter, and I'm an RN.
Amazing. Well, ladies, thank you so much for being here tonight. I know that your lives are super busy, so we'll get right to it. And I know everyone else that's watching is super busy too. So I appreciate you being here this evening and taking the time for you to really realize that there is hope for migraine freedom. So do me a favor, if you're watching right now over on Facebook, give me a like, give me a love, let me know you're there, let me know where you're watching from. And let me know what it is that you do, whether that is you are an amazing stay-at-home mom, you're out in the world, working world somewhere, or maybe migraines has taken that from you right now. Let us know what fills your days on a daily basis. All right, Nicole, we're going to jump in with you. We're going to have you get us started. So considering your background in, healthcare, in nursing, and the substantial access that you had to training and resources and health information, why do you think you and so many women like you struggle to find migraine freedom on your own?
Wow, what a great question. I'm trained conventionally, just like our neurologists are. So in conventional medicine, we deal with symptoms. We don't deal with the root cause. And honestly, after 2+ decades of migraines, I did not know what my root cause was. That was never able to be shared with me with any of my neurologists through the past 2 decades until you popped up on my Facebook feed, and the first video that I saw was the root cause of your migraines is inflammation. And that was an aha moment for me. So with the training that I have, I was under the impression that medications were the only thing that were going to work for me as well. And I realized after my first visit, and I walked out with, this is 23 years ago, with a handful of scripts, that this wasn't the life that I had planned for myself to be, relying on prescription medications. So I started doing a little bit of research, but everything that I had access to was medication related, prescription related. So in my journey of trying to find my migraine freedom on my own, I was making some progress. However, what I would say to you is I was working on one area of inflammation and sporadically working on another, years and years apart. And it wasn't until I learned about the Freedom from Migraine Method protocol and the 6 key areas of inflammation, and having a roadmap to follow methodically, starting at the first module and continuing down with the first module, adding to the second, and so on and so forth. And I no longer was trying to put this big puzzle together with many missing pieces. So that was a huge eye opener for me. And this program and working on my inflammation has brought me my migraine freedom, not conventional medicine. So
yeah, and we love conventional medicine. So anyone that's watching, we are not here bashing conventional medicine at all. It can have a very good place in our lives, right? If I go out and knock on wood, let's say I get into a little car accident right now, my leg is broken. I want a doctor that can fix my broken leg, right? But if I have all these things like migraines and symptoms, like gut health symptoms and all those, I want to be able to look at my whole body as, what is going on overall and how can I fix that? And that's kind of the difference between conventional and functional. So thank you for explaining that, Nicole. I think it's a very important distinction for everyone to realize. All right, Christine. Poor Christine is having some computer challenges today, so everyone hang in there with her. Hopefully we're not going to be too echoey, but Christine, thank you so much for being here. So you did Freedom from Migraine Method a while ago, right? You've been graduated for quite a
I
while.
did. I graduated, I started in November of last year. So yeah, I've been graduated for quite a while and I feel great. I've never felt better. I'm older, but I never felt any better. So that's fabulous for me. Was life-changing.
Amazing. So
Life-changing.
before you did the program, what conventional methods did you explore in your journey to try to end your migraines?
Because of my healthcare background, I did take pharmacology classes. I knew what all these medications were going to do to my body. So I really did not go the prescription route, medication the route. I kind of just suffered with my pain. My migraines were not debilitating. They were certainly uncomfortable to say the least, and definitely affected my daily life, but didn't leave me in bed every day. So I was able to function. I did use over-the-counter medications. I used allergy medications because I thought maybe I was some sort of an allergy. And my poor dog, I thought I was allergic to him. I did the chiropractor. I did massage. I did the TENS unit. I did and then a whole bunch of homeopathic things. But I was a bit more proactive. Once I didn't have migraines my whole life. I didn't get migraines until probably kind of at the end of the very start of menopause. Like most people think menopause is going to fix their migraines. It kind of gave me migraines. So I was kind of proactive. I really, once I started to get these migraines, I was like on it.
Yeah.
And I found your group pretty quickly. I did the master class and I was hooked. I said, this lady knows what she's doing and I want to be part of this. I just didn't want to do the medication route. My mother-in-law, I watched my mother-in-law, oh my God, since she was 13 years old, suffer with migraines, and she took every medication under the sun, and she was rebound after rebound headache. She was addicted to medication. She was sick from the medication, so I wasn't going to do that.
Yeah.
So I was really, looking for some alternative to the medication.
Yeah. Well, we're so glad that you found us. And I know for you, your journey was a little long, kind of took you towards the end of the program before you, those results hit. But man, when they did, they did. So we're so happy to see that you're still doing so great.
Yeah. And I can even, I don't want to say cheat because that's not really a good word, but I get to indulge a little bit and I don't have the consequences. So that's great.
I love that word. Thank you for changing that because I would have said something about cheat.
Yeah.
Amazing. Thank you, Christine. All right.
Thanks.
Okay, so many women, as Christine mentioned, kind of conventional route and functional route, many women compare alternative options such as, chiropractics and acupuncture and naturopathics to Freedom from Migraine method. They think, well, I've already tried those, right? Yes, I know the meds don't work, but I've already tried those things. So they think that if they have tried them, that the Freedom from Migraine method won't work, which we know isn't truthful. So which non-traditional remedies did you experiment with? And what do you think was lacking in those approaches that actually prevented them from really mitigating your migraines for you?
Yeah. Oh, I tried everything. I tried acupuncture. I tried physical therapy. I tried the chiropractors, massage, and a naturopath. And I went there twice. And it was cash money every time. And I came home with all these supplements that I literally couldn't take. They made me so sick. Nobody, asked me about that. Well, anyway, so I think the big difference is that we really look at women individually. Like Nicole was saying, we have more of an individual plan. We just don't take you and throw you in a group and say, this is going to work, this is going to work, this is going to work. And so that is one thing that I really love about your program is that everybody is treated individual. Yep, we have steps, we have guidelines to go through, but a lot of those have to be tweaked for certain women in order for them to find success. And the longer I've been in this program, the more I see that with every woman, and I think the other chiropractor, all that stuff, they just threw things at you that were just, I'm going to fix your neck. That's the problem, or I'm going to, massage you and then you get a migraine, or just throw all these supplements at you
Yeah.
that cost hundreds and hundreds of dollars that did not help.
Yeah. And some of those modalities, like you can go to the massage therapist and maybe feel better for a few days. I mean, some people, for me, it always made it worse. But for some people, maybe you get a few days out of it. Maybe you do go to the chiropractor and maybe the adjustment sticks for a week or two, right? But until you get to the root cause, all of those things are just going to be more Band-Aid fixes and more management tools, which is what we're
Yes.
trying to kind of get across with everyone today, is that we don't, yes, we may share some management tools in the program in the beginning so you're not in massive pain, but the goal isn't to continue to use those. The goal is to get to the root cause so that the next time you go get a massage, you can do it for fun. You can enjoy it. You can not be in pain, and you can say, I am just here because I need to be here, not because I need to function tomorrow. Right? There's a big difference in shelling out however much money it costs for a massage when it's for fun compared to survival mode. So yeah. So let's just do this really quick before we go to Susan, because I'm just curious. If everyone has a laundry list of the things they've tried, Jackie just listed up all the things that she tried to end her migraines. Let's share a little laundry list with everyone. I'll start, and then maybe we can go Nicole, Christine, and then we'll do Susan last because we'll do her question then. So it has been over 10 years since I've had migraines. So I had migraines, 20 years ago. And I think I tried every med under the sun that was available then. I was on 7 different medications at one time. My doctor was really big at just throwing meds at the problem. Oh, you can't sleep? Here's some amitriptyline. Oh, you're depressed? Here's a med for that. Oh, you have migraines? Here's a med for that. Oh, you're, I don't know, whatever it was. We just kept throwing meds at. You're starting to gain weight? Here's a med for that. So I really did a lot of the medication route. I did not do Botox because I just started realizing this isn't right. So then I went the alternative route. Like, I spent so much money at the chiropractor and physical therapy and massage therapy. I mean, I don't want to say it too loud because my husband's home, but it was like tens of thousands of dollars probably that I spent just to try to function. And that's why I always thought that nothing else would work, because I dumped so much money into that. But it wasn't until I actually did the training and the research to realize, even though those are alternative, they're still management tools. So those are the things I did. How about you, Nicole? I know you have a nice little laundry list.
Well, I'll add on to both you and Jackie because I had all of those modalities of treatment as well. But I did hyperbaric oxygen therapy, self-prescribed. I removed my breast implants. I purchased a new COM, which takes you from the sympathetic nervous system to the parasympathetic nervous system. And it was extremely expensive. Now you can do it online, with an app. But back then I still have the whole machine, and it's helpful. I bought the Ion Cleanse foot bath, helpful as well.
I did do that as well. Yep.
A $900 Prana mattress for my neck.
You love the
pain.
mattress.
Yes, yes, but it didn't take my migraines away. I did EMDR therapy, helpful, worked on some traumas, but that was not the fix either. And the fascia blaster, which that has to do with the connective tissue and the fascia being really, really tight.
Mm-hmm.
And if you loosen that, then that's going to loosen everything up. And then your migraine, will help migraines too. So all of these tools, there are benefits,
Mm-hmm.
but I didn't have, like I said, a roadmap. I gave up my research degree. that I gave myself. I had a PhD in migraine research. When I joined the program, I tore that up and I just followed your program because I've tried all of these things. And I mean, not only the money, but the hours that I can never get back that I've spent with Dr. Google and practitioners that have referred me to these products. So
Thank you for sharing that, Nicole. And I can imagine, I mean, for any of us, it's hard to stop researching, right? When you're in pain, you kind of want to be in control, you want to research. But I can imagine being in the healthcare field, that's a little harder to let go, to have faith and trust that somebody, I'm not a nurse. I admit it, I'm not a nurse, but to have faith and trust in someone that, okay, maybe they do know what's going on. And for those of you who are like, wait a minute, she's not a nurse on here. No, I'm not. I am a health coach specialist and I live, eat, and breathe migraine 24/7. These guys will tell you in my sleep, I'm dreaming about migraines. But that is what makes our team so amazing because I can share the research I do on a daily basis so that you don't have to. The books that I read on a weekly basis so that you don't have to, so that I can sort through all that and make life a little bit easier. All right, here I go. I said I wasn't going to get off on the wrong track, so I'm going to let Christine say her list. Christine, was there anything else that you tried that these ladies haven't mentioned?
No, not really, except pillows. I must have bought 100 pillows to
That
fix
is
my
great.
neck,
I hear
which
that a lot.
I was convinced was the root of the cause of my migraines was my neck. And, you know, sadly, each time you go to the chiropractor and they tell you, oh, it's your neck and we can fix you. And you go to the massage therapist and they're like, oh, you're so tight from your job, your shoulders, your neck, everything's so tight. Well, we can fix you. We can fix that. So that's the trap we fall into.
And that probably made a lot of sense for you, right? With the job that you have.
Yeah. And yeah, I believed him. And you fall into that trap because you're desperate. You'll believe anything at this point.
I am so glad you brought up the pillows because I think there was a post within the last few weeks in the group. One of our private clients, I think, asked about pillows and not that I'm not for buying a new pillow, but you don't need to buy 100 pillows to try to fix your neck. You just need to fix your information to fix your neck.
I know that now.
Yeah, exactly. All right, Susan, how about you? Have you tried all the same things? I think we listed a lot of them, so I'm not sure how many left there are.
Oh, there's more.
All right, let's hear them.
I also did the Botox and I did everything else they've already said. I did a TENS unit. I got my daith pierced, the piece in your ear. I did that twice. And NeuroLens. It's a fairly new specific eyeglasses. So I have NeuroLens, which were not cheap,
I bet they
like
were.
all of our other things.
Yeah, that is a lot. Hey, everybody that's watching, do me a favor. If there's something that you've tried that we didn't list, can you mention that for me? I like to make this little list of all the things that everyone's tried. I'm sure there's going to be a few on there like that we didn't mention today. And actually, we had two other ladies that were supposed to join us, but one whose birthday it is. She was going to be our other dental hygienist that was going to join us. But I suppose it's her birthday. We should allow her to celebrate that instead of hanging out with us. But I know many women have tried hysterectomies. Those have been recommended by their doctor. HRT, the birth control pill, nerve surgeries. Those are some of the main ones that I hear quite often. So let me know. I'll double check the comments in just a quick second, but let me know if there's something else that you've tried to either manage your migraines or tried to end your migraines that we haven't brought up today. All right, Susan, since you're in the hot seat, and this is going to be a loaded question, and we'll see if anybody else wants to add in here too. What improvements would you suggest for the healthcare system, in terms of supporting women who experience migraines, and how does that relate to the approaches that we used in the Freedom from Migraine method? So you get to reinvent healthcare right now. What are we doing?
Perfect. Yes. I think Nicole brought up that the healthcare system looks at symptoms, not at the root cause. It's looking at healthcare, not wellness care.
Mm-hmm.
And they look at everybody as a group. So you have migraines, this is going to work. You have this is going to work. Well, everybody's individualized and they just keep throwing meds at you because, like you had said, now you're gaining weight. Now you're getting constipated. Now you're this and that. So they just throw more meds at you. And they don't discuss the natural things. Cutting out sugar or increasing your water or other things like that. And I had been doctoring with a neurologist for years before I heard the term medication overuse, that I was getting rebound headaches just from using the medications. And I didn't know that that was a thing, even though I'm in the healthcare field. And I'd been doctoring for 5 or 6 years with my neurologist. And then he tells me, well, you need to stop taking your meds. Well, you're the one that ordered them. So how am I supposed to stop? And so I think it is a one size fits all type. Healthcare can be that way. And so that's what I think needs to be focused on, is each person individually.
I love that. I love that. And that's kind of why we created the Migraine Freedom Protocol in this group. We focus on the 6 key areas of inflammation, but we give the foundation of those 6 key areas. But then if you end up working with us privately, whether that's in one of our group programs or one-on-one coaching, we help you take that information and tailor it to you. Our job is not to dictate what you do, but to listen to you, listen to how you want to live your life, what goals you want to accomplish, how quickly you want to accomplish them, and then help you determine the shifts that you can make to get there. Pretty much everybody on this call right here wants total migraine freedom, so they're doing everything. But believe it or not, there are some women that are like, hey, if I can go from 30 migraines a month to 3, and I can get rid of those 3 with an Advil, and I can drink a couple glasses of wine a month, I'm good. I'm good, right? And then there are other people, Nicole, I'm just going to throw you under the bus, like Nicole, who's like, you tell me what to do and I'm doing it. I want 0. I don't care if I have to stand on my head naked twice a day. I'm going to do it, right? That is Nicole. And I can say that because Nicole's on my team too, so I can bug her. She can take it. But that's the difference, I think. When you go to a doctor, the doctor's like, all right, I just don't want this person in pain. So what can I do quick to try to help them be out of pain? Here's your med. And now I got to go help the next person, because sadly, my docket is backed up with 50 patients today who have the same thing going on. And again, this is not to pick on conventional medicine. That's not what we are trying to do here today. We're trying to show the difference. And so that you can look at your body and say, what is it that's wrong with me? And which direction am I going to be best to go in for this particular thing? I need to help with migraines. You should probably be going the functional approach. I have a broken leg. You should probably be going to the conventional side, because if you have a broken leg, I'm not going to be able to fix you with the 6 key areas of inflammation, right? You need someone to set your leg, and then I can help you after. Once you get that part done, I can help you heal faster. Absolutely. But that's where those differences are. All right. I'm just going to check out comments here really quick. And then the ladies that are on this panel right now, think about one thing that maybe you want to say to everyone before we end. And maybe we can just go around really quick and I'll let you say one thing. But I just want to double check all the comments for these amazing ladies that are on watching. We've got Jen on, who's an RN. She works from home and lives on her ranch and farm. I got to talk to Jen today. That was amazing. Kathy remembers her GP telling her he wanted to give me neck injections. And that began her search for a better approach very quickly. Kathy remembers looking at a ton of pillows, so she's right there with you, Christine. Kim got occipital nerve blocks. Yes, we've heard a lot of that. We've had dry needling, craniosacral therapy with an OT, somebody else with nerve blocks. Oh, steroids. I forgot about steroids. Trigger point injections, all the muscle relaxants, absolutely. Emgality. And Kim took her teenage daughter to a pediatric neurologist who said there was no such thing as triggers for migraines. Interesting. Very interesting. All right. Isn't it amazing the different doctors you go to and what they will say? All right, we'll leave it at that. But thank you everyone for being here today, and keep adding the comments. If you're watching on the replay, give us a hashtag replay, and please answer the questions as you go through. I would love to know the things that you've tried. And also let us know if you have any questions for these ladies. If you don't have any questions today and you think of something later, all you have to do is put the question in here, maybe tag myself or tag Valentina or Kathy, and we'll make sure the question gets to the right person for you. And you can see Kathy and Valentina, Kathy Summers, Valentina Martinez, they're both on here. So all you need to do is click their name, and that will take you to being able to send them a direct message to get any support or help you need. Okay, let's go in order, at least order on my screen. So Jackie, you're on top. Anything you want to say to these ladies before we finish up today?
Just that this program has lots of support for women.
Amazing. Nicole?
There is hope. Don't lose the hope. I felt like the salmon swimming upstream for 2+ decades. And I never lost that little tiny bit of hope that I had in my heart. And I found it with Freedom from Migraine Protocol.
I love that. Susan?
The information's already out there for you. Just follow the program. It works. It's worked for thousands of women already.
Amazing. Christine?
I just want to say, take control of your own health. Don't let your health insurance dictate what kind of care you're going to get. Just because your health insurance doesn't cover something does not mean that it's not going to work. I see that too many times in my job. People will choose not to do the dental work that they desperately need because their quote insurance won't pay for it. All of it, any of it, some of it. This is your body, this is your health, this is your life. Take charge of it.
Oh, I am so glad you brought that up, Christine. And you and I have talked about this before. We need to, and I should actually do a talk on this. We need to focus on dental health and its importance to your overall health. Because if you've got something going on in your mouth, guess what? It's causing inflammation. And what did we all start this call with talking about? What triggers migraines? Chronic inflammation. So if you are not able to care for your mouth, that is just putting one more tick against you in your, in your migraine, having more migraines, I should say. So I know dental work can be expensive, but as Christine said, when it comes to our health, I don't really think we can put a price tag on that. I really don't think we can. And I'll sum up in this way. If any of you have not seen our new podcast yet, Migraine Freedom Your Way, we did a podcast on the cost of migraines. And I actually created a migraine cost calculator to go with this podcast. And I really think that this is something that everyone should take 5 minutes to do. So we'll just use an example. Let's say you need some massive dental work and you don't get it done. And, the dental work, maybe it was going to cost $10,000. I don't know. We'll just make up a number. It was going to be $10,000. 15 years from now, your mouth is still in the same shape. That $15,000, if you had just spent the money and found a way to do it, and I know it would be hard, but if you just found a way to do it, it probably wouldn't cost you the $50,000, $60,000, $70,000 that now you're going to have to pay out, not only to fix your mouth, but to fix what other health issues are now going to come about because you weren't able to take care of that. Now, before everybody gets angry at me watching, I am not saying I want to take a roof from over your head or food from off your table. I don't want anyone to go broke having to take care of their health. The point of this is to explain that your health is priceless. So when you sit down and go through this calculator that I created, it's really going to show you where your priorities are and how you can actually find a way to make your health a priority. And even Dave Ramsey agrees with me. So if you are big Dave Ramsey fans, watch for my post tomorrow, where I'm actually going to quote some info from Dave that I think you're all going to be really surprised about. All right, everybody, this was an amazing call. Ladies, thank you so much for being here today. I wish that everyone could clap for you right now and give you a big thank you. So I will do it for them. Thank you so much for all of your time. Really, really appreciate you being here. And I know this call is going to resonate with so many people. We will be back next week for our migraine strategy call. It'll be at our normal day and time. We'll be back on Thursday at 1:30 p.m. Eastern Standard Time. And for those of you who are not signed up for the challenge, comment challenge below. Make sure you get signed up. There's still time. All right, everybody, have a great night. Thanks so much. Take care.